Dr. Godat's here today for follow-up of his arthritic ball and socket joint in his shoulder, the glenohumeral joint as we refer to it. As you can tell, he has lifted a lot of weights over the years. The last time we saw him, we recommended an injection with hyaluronic acid and a little bit of cortisone. That was given in February, and he's done well for the last couple of months. But one of the main reasons he's done well is he's followed some pretty simple advice that I've given him about weightlifting, and I'd like to share that advice with you. I call this my Pecs Without Pain program, and I was going to write a self-help book and get on Oprah Winfrey, but I only came up with one page of useful information, and I'm going to share it with you now. A lot of men are concerned about the way their pecs look, their biceps looks, and their deltoid looks. If you do heavy bench press, you will get arthritis in your shoulder. You may also tear your rotator cuff. You will get arthritis in the AC joint, and you can even rupture your pectoralis major muscle if you do too much weight. With this program, which is designed, I think, for everybody, you can maintain the tone in your muscles, maintain your strength, but not risk damage to the ball and socket joint, which has very thin cartilage and has primarily a job to reach up and pull things down to you, not to be loaded. So the pectoralis major is essentially two separate muscles. We're going to have David hold his arm here and tilt your head back just a little bit. Here's the sternal portion of the pectoralis major coming across here. And this is called the clavicular portion, the portion that comes from the collarbone down to the humerus. So this particular exercise, which some people do in a butterfly machine, you can do it on a cable weight machine. And I usually recommend the free motion machine that's almost in every gym because you can adjust it to your height. So the cable should be about here. And what I want you to concentrate on is what happens to his pec when he pushes against my hand. So you can see how that tightens up his sternal portion of his pectoralis major. So you can do that with whatever weight you can tolerate through short arcs and not overly repetitious. One of the issues that we face a lot of times in people that have lifted weights, you tell them you got to lift less weights, says, okay, fine, doc, I'll just do more repetitions. Well, there's a whole constellation of injuries that are called repetitive use injuries. So more repetitions isn't necessarily good. To exercise the clavicular head of the pec, which is this muscle going from here to here, we're going to merely have him do what looks like an uppercut punch. So concentrate right here and then push up against my hand there. Push this way, a little bit farther that way. And then you can see the entire pec coming from here to here firing. There's still some contribution from the sternal head, but this will really exercise your clavicular head quite well. And again, you just punch up like this, just like you were doing an uppercut. So that's the pec. The deltoid has three separate parts. The anterior part, which does this to your arm, the lateral part, which does this to your arm, and the posterior part, which pulls your arm back like that. We recommend doing the deltoid again with a cable and just watch this muscle here push out against me, and you can see the deltoid muscle firing. The pec isn't quite as active in this maneuver because we're over a little bit farther. You can rotate the arm perhaps out a little bit farther and then do it there. Again, you can see the definition in his deltoid muscles. His traps being exercised as well. The posterior deltoid you can do with basically what is called a row, and I like a seated row. Nothing good happens to your arms up in this position, so I don't usually recommend a rowing machine. But a seated row, and can I get you to turn this way for me a little bit? So push back against my hand here. Here you can see his posterior deltoid firing completely. Again, his trap is working here as well. Triceps is working, and probably his brachioradialis also to do that maneuver. Okay? And then the lateral deltoid is the exercise that most people try to do a lateral raise with, and there's nothing good that happens with your arm out in this position. You increase the joint reaction force by several times, sometimes as much as your entire body weight, and the rotator cuff in an obligated fashion, it will come into contact with a bone that's up here called the acromion. So nothing good happens in these higher arcs of lateral elevation. So what I have patients do is a very short arc or even just an isometric exercise. Dan, come around here for just a second and show what happens. This is his lateral deltoid. This is just an isometric contraction there. And then let it go. So it's a myth that you have to exercise muscles through their entire range of motion, especially if you already have limited range of motion, which he does from his arthritic condition. All of those exercises are designed to decrease the joint reaction force. The rotator cuff is strengthened with the same type of machine or with tubing, and the subscapularis, which is the muscle in the front, is exercised by merely internally rotating your arm. So take your hand and push it down to your chest there. You can still see he gets a lot of activity in his other muscles, but that's an exercise that's primarily, and his pec is working there too, but deep down inside, that's working his subscapularis muscle. The supraspinatus is going to be exercised the exact same way as your deltoid does. You can do that as an isometric exercise, and especially in patients after supraspinatus repairs for the rotator cuff, we try to get them to stay away from any kind of high lateral arc exercise. The muscles in the back that are important for your rotator cuff, can I turn this way one more time for you? Are the infraspinatus, which is down here. Again, the supraspinatus is covered by his really huge trap, but this is the infraspinatus muscle, and it's going to be exercised by rotating the arm out against resistance. So again, you can see the trap fire. This is his infraspinatus firing back here. Relax your muscles. Now we're going to put your arm in just a little bit more rotation. Turn this way just a little bit more. And now push against my hand here. So again, you can see all this musculature here. This is all the infraspinatus. Shrugs are a good exercise. Try to shrug your shoulders up with weights. Again, that'll exercise your trapezius. And the other exercise that helps with scapular stabilization is this seated row. So pull back against me here again and concentrate over here. Turn just a little bit more towards Dan if you could. No, the other way. Okay. Concentrate on these muscles right in here and see what happens when you do that row. So again, upper rhomboid, trap, middle rhomboid, lat's going to be firing in here as well. So I think if you can get patients to modify the way they lift weights and to a certain extent their body consciousness, if that's needed as well, their shoulders are going to last a lot longer, and hopefully we'll be doing fewer shoulder replacements, because these individuals, if they continue to lift weights, they will get arthritis that requires shoulder replacement, and if they continue to lift weights after a shoulder replacement, very likely the shoulder replacement will wear out a lot sooner than if it's used in a more normal fashion.